That blood clot in the deeper veins of your legs, your thighs, or other parts of the body is called DVT, usually referred to as deep venous thrombosis. The blood clots in veins often present in the leg, in the calf, but often occur elsewhere in other parts of the body. DVT therefore falls in a group of problems known as thromboembolism. It's estimated that in the UK, 1 in 1,000 people will have DVT. Immobility is the most common cause of the blood clots developing. When the blood clots, it breaks down and travels to the lungs, and this is called pulmonary embolism, referred to commonly as PE. Once this happens, you will have to be given anticoagulants. These clots tend to develop in one of the deep leg veins. The affected leg will become very painful, swollen, dark or red in color, and at times warm. The clot will then break off and travel to the lungs, causing an embolus. That broken clot that travels to the lungs is called an embolus. Anatomically, these deep leg veins run through the calf and thigh muscles and are larger, unlike the veins you see under the skin. Sometimes they can be mistaken for varicose veins. The blood clots tend to partially or completely block the vein. They completely block the affected vein, affecting normal blood flow in the leg. So today we're just going to be discussing DVT in the calf muscles. One day we will discuss the other types of DVT. It's important to note that normal blood flow in the veins is usually quick and with no blood clots. This is helped by the movements of the legs, where the muscle movements squeezes the veins and pushes the blood forward. However, there are times when DVT occurs for unknown reasons. A lot of times patients wonder what has made them have DVT. There are some conditions that cause DVT. For example, thrombophilia, nephrotic syndrome, antiphospholic syndrome. And some are inherited, like it's in the family. It's easily detected by blood tests. Some include conditions like factor V-laden mutation. Some contraceptives also increase the risk of DVT. For example, those who are on pills like estrogen that slowly damages the veins by causing blood clots easily. Another cause of DVT could be contraceptives, patches, and hormonal replacement therapy. Some women on pills like estrogen can easily damage the veins by causing blood clots easily. Women taking combined oral contraceptives also are at risk. Investigations for someone newly diagnosed with DVT will include tumor markers, which will be done by testing the blood and may show cancer or an underlying cause of the DVT. Then there is the older people, 60 years and above, also poor mobility or serious illness. They are at a risk of developing DVT. Pregnant women are also at a risk of developing DVT, especially after 6 months, from 6 months to delivery. The women are at risk, and it's approximately 1 to 1,000 women have DVT in pregnancy. Then high obesity increases the risk of developing DVT. If you're obese, then you're at risk of developing DVT. Dehydration, meaning lack of fluid in the body, makes the blood sticky and flows very slowly and may form clots. Then there are those patients who are immobile, like the ones in ITU, the ones with fractures, who are in plaster casts. If they're not really mobile, then the blood flow will be slowed down and they can form blood clots unless they are put on anticoagulants. Patients having long surgery like pelvic surgery are also prone to developing blood clots, forming DVT. So they will be given anticoagulants to stop, depending on what the anesthetists and the surgeons have agreed on and what they have planned. These patients will always have TEDs, and they will have Clotons to keep pumping the legs, because definitely they'll be paralyzed, so the muscles will not be moving. Patient is asleep, and it's the responsibility of the theater people to make sure that the patient does not form clots. Other patients who will form clots are people who are on long flights. If you're on long flights and you sit in one place for long, then you will also get DVT. You can easily form a clot. So while you're traveling on the air, bus, train for long distances, over 4 hours, they also require to walk around on the plane, on the flight, on the train, and on the bus. If you're on a car, you need to stop somewhere, take a break, and walk to prevent having DVT. It's also advisable that when you're traveling in such cases, then you drink a lot of fluids and wear TED stockings if you can. So what are the symptoms that will make you feel like you have DVT, or suspect that you have DVT, or before you go to the doctor, or make the doctor think that you have DVT? First of all, DVT again commonly forms in a vein below the knee in the calf muscles. Therefore, it will be painful on the calf. There'll be a swelling of the calf, the color and temperature changes of the calf, in that the calf may be dark and warm. There may also be no symptoms for DVT, but can only be diagnosed after complications has occurred. And the complications may be pulmonary embolism, which means the DVT was not diagnosed, but the symptoms of pulmonary embolism are the reasons why you are diagnosing a PE. How do we diagnose DVT? It is difficult to diagnose just from the symptoms because of differential diagnosis. Sometimes there are conditions that present like the DVT presents, such as cellulitis of the leg, which is the infection on the skin, or infection or muscle strain. Some people will present with muscle strain or cellulitis and can be mistaken for DVT. And also DVT could be mistaken for cellulitis, which is the inflammation of the skin of the calf, and muscle strain on the calf. The other test that is used to diagnose DVT is a blood test. This blood test is referred to as D-dimers. D-dimers shows fragments of broken down clots. The higher the amount, the level in the blood, the more likely you have DVT, and the more the risk. It is important to note, though, that there are conditions where this test may be positive, like post a major surgery or pregnancy, but there is no DVT. The test, therefore, will be a sign of you having DVT or pulmonary embolism, and is a guide to have further tests. If the D-dimer test is positive and there's still like breathlessness, symptoms of pulmonary embolism, of left-sided chest pain, breathlessness, low oxygen saturations, then they will go further to do further tests like computerized tomography for the chest, that is chest CT. And this will clearly show, if they use a contrast, it will show where the embolus is in the lungs. It could be an embolus on one lung, or it could be bilateral, which is more risky. The other test is duplex Doppler. This is usually the first one they do, although the waiting time may be longer. It's an ultrasound, a special ultrasound that shows blood flow in the leg veins and any blocked veins. This is recommended and is done within 4 hours of the patient presentation, and where not possible, an anticoagulant drug is started immediately while you wait for the scan. So patients will always ask, what complications does the DVT bring to them? The blood that clots in the leg usually remains stuck on the vein wall. The symptoms tend to settle gradually. However, there are two main possible complications for DVT. The major one is pulmonary embolism. This again is the blood clot that breaks off and travels to the lungs. This, if not treated fast, can cause death. The second one is post-thrombotic syndrome. This is the persistent cough symptoms. Where the clot was, there'll be pain, it's always persisting, and still will be redness. So we start with pulmonary embolism. In some people, the blood clot in DVT breaks off and travels to through the bloodstream to the lungs and is called an embolus and forms pulmonary embolism in the lungs. The word pulmonary refers to the lungs. This will travel through the bloodstream until it gets stuck. A blood clot that breaks from the calf vein and travels through the body veins to the heart, through the large heart chambers, but will get stuck in the blood vessels going to the lungs, causing pulmonary embolism. Deep venous thrombosis and pulmonary embolism are collectively known as thromboembolism. It is important to note that there may be no symptoms with small PE. Medium PE can cause chest pain and breathing problems. A large PE can cause collapse and sudden death. Post-thrombotic syndrome. 5 in 10 people will have had DVT without treatment and will develop long-term symptoms of the calf. The tissue of the calf is affected due to increased flow of pressure of the diverted blood. Because of the blockage, the blood will be diverted and it will be increased flow. So the damage to the veins will be occurring. The symptoms for post-thrombotic syndrome ranges from mild to severe with calf pains, swelling, discomfort, rashes, and in worst cases, there may be an ulcer formation from the skin of the calf. Post-thrombotic syndrome is also more likely to occur if the patient DVT occurs in the thigh or extends to the thigh vein from the calf. It is also more common in obese and overweight individuals, those who have had more than one DVT in the same leg, and those above 60 years of age. What are the aims of treating DVT? Obviously, it is important to treat DVT because of the complications that we have discussed. We need to prevent those complications. So we are supposed to prevent clots from spreading up the vein and getting larger, breaking off, getting to the lungs, and forming a PE. Therefore, what will your doctor give you for DVT treatment? The doctor, after the diagnosis has been made, will definitely give you anticoagulants. It will be started immediately. That is medicines that thin the blood so that the clot formation is reduced. And these are referred to as anticoagulants. These medications alter certain chemicals in the blood to stop clot formation. They also help in prevention of DVC from getting larger and formation of new clots. One therefore will take these medications for at least 3 months. I can say 3 to 6 months. The length will be determined by various reasons. If the risk increases, then maybe long term. to reduce the risk of post-thrombotic syndrome developing. The third one is to reduce the risk of venous ulcers in the legs in the future, and also to reduce the risk of DVT, a recurring DVT in the future. Other treatments for DVT include clot busting, that is thrombolytic therapy with medicines such as streptokinase or urokinase. This may help dissolve the blood clot. The medicines are given directly into the vein and sometimes directly to the clot via a tube, which is a catheter. Occasionally, an operation will be done to filter the large veins of the blocked leg vein. Sometimes an operation called embolectomy is done to remove the blood clot from the leg or vein or pulmonary artery. To prevent recurrence of DVT, then we need to follow the instructions that we've just mentioned. Normally, postoperatively, DVT is a one-off occurrence, but there are people who it may not be because of an operation, it may be because of some other conditions and could possibly reoccur. So they will continuously be on anticoagulants. So in that case, if possible, avoid long periods of immobility and sitting on a chair many hours. And if you're able to walk around now and then. A daily brisk walk for 30 to 60 minutes would do, or even better if you can do this longer. The aim is to stop blood pooling and to get the circulation in legs moving. Regular exercises and calf muscles also can help. You can do some calf muscles even when you are sitting. Persistent calf symptoms may occur after a DVT. With treatment, the risk of the above two complications is much reduced. Treatment includes anticoagulation medicines, compression stockings, leg elevation when sitting down, and keeping active. Prevention is important if you have an increased risk of DVT. For example, during long operations or when you travel long journeys. It's important to reduce the risk of DVT formation on patients who are in hospital. For example, if they're coming to theater, make sure they have TED socks, and we use flotons that is connected to a machine that pumps the legs and massages the legs so that there is no the DVT formation. For people who are having long cases, DVT formation is prevented. And also, if they are not mobile, you can be raising their legs up on a pillow. Patients who have had DVT before are at risk, so they could continuously be monitored for, and a plan should be made for their management and care to prevent DVT formation. In summary, therefore, we have said DVT is that blood clot that forms in the deeper veins of your legs, your thighs, and other parts of the body. The main cause of DVT is immobility, especially during surgery. If you are having major surgery, you will usually be given medication with injections to prevent blood clots forming, and this is called thromboprophylaxis. The most serious complication of DVT is PE, which is pulmonary embolism, where part of the blood clots breaks off and travels to the lung. PEs can cause death. Blood tests to check if they have DVT will also be performed. If they are suspected to have DVT in hospital, they could also do Doppler test, the scan, so that they make a diagnosis if they think there are symptoms of DVT. This comes to the end of this video. It has been long, so I will be talking about long travels, long journeys, DVT in long journey. Thank you for listening. Subscribe, please, like, and share. Hope to see you in the next video, and thank you for watching.